face that glass door, your whole body. Good. Face the wall with the diplomas. And face the windows. Okay, now come take a seat here with Dr. Shoshani.
All right. So today is July 2nd, 2024. You found us online, I'm assuming?
Yes.
Okay, and briefly you told me, you said how many years ago you had a slip and fall?
Around 2020, so about
So
4
2020,
years.
4 years ago, slip and fall. Were you hospitalized? Urgent care? Anything?
No, I stood up. I felt my right leg go a little numb, but I was just, you know, I'm the type of person that just puts
Move
stuff
forward.
off. Yeah, just
Right,
I
but it's-
said, I'll walk it off, and I walked it off, and
And it catches up to you. All right. Any surgeries, any traumas, anything
not
like that?
involving my back.
Not involving your back. And now, right now, you're having it down the left leg?
Yeah, my lower back, my butt, my left leg, even my groin is numb. Like,
In the front?
yeah, groin and in the back. is
Okay.
numb.
And does it go below the knee or stops at the knee?
No, my calves feel like they're gonna be cramped.
Both?
Yeah, both.
Okay. All right. And have you seen anybody for this? And now the first time, and how did it turn out? You're like, oh, I'm gonna go to this.
Cause I got up and I felt this pain every time I walked, or even standing, like I stood up and I couldn't stand up for more than a couple of seconds.
So green line is the center of gravity,
Mhm.
and red is where you are. So it looks like your left shoulder is elevated,
Mhm.
and it looks like your pelvis is kind of shifted that way.
Yeah,
And I know you feel this way. You don't feel like you're walking right, left shoulder
no,
high.
not at all.
Okay, so there's definitely some imbalances there. Now, did anyone ever take any imaging of your spine, and what did they show?
My doctor said there was like an old fracture there.
From the fall?
I don't know if it's from the fall or from like a car accident or something.
From years ago.
Yeah.
But it's healed. All right, so you're 53, no car accidents, traumas, no spinal surgeries. So your primary complaint is left-sided leg pain / sciatica and lower back pain.
Yeah.
Does it get worse when you cough and sneeze and all that
Oh
stuff?
yeah, when I breathe even,
So it's like a deep like herniation. Did you do an MRI?
it's hurt. I don't know, not for that, no.
Okay.
Not for
All right. So let's see you stand up. Okay, so right now getting out of a chair is difficult. Walk over there. So we're just watching you walk. So you can see how it's a little bit gimpy, like you're kind of putting a lot of weight on the right leg, you're taking weight off the left leg.
Yeah, 'cause
and now if you walk again towards me, now if you put your weight on the left leg more, it hurts more?
When I take a step with the left leg, yeah,
Yeah.
it hurts.
So that's why and this has been walking like this for the last week? Okay.
Yeah, more or less. Sometimes like if I get up from the sitting position and like I can't even draw blood because I can't stand up long enough to like, you know,
Then you're a nurse?
well, I'm a medical assistant.
Medical
at the
assistant.
bottom.
Have a seat right here, just sitting.
Okay.
Scooch all the way back. And have you previously had chiropractic care before?
When I was younger, I used to box.
Okay.
And
Just look straight ahead.
yeah.
Good. Push up into my hands. Okay, good. Push up into my hands. Good. Kick out into my hands. Good. Kick out into my hands. So you have pretty good strength. Push your toes up into my hands. Good. Toes up. Good. Toes down. Good.
Oh, that
Toes,
hurts.
toes down. Okay, so S1. So you probably have like an L5, S1 disc involvement, but no MRI was done, right?
Mm.
Okay. All right, so what we're going to do is I'm going to take your head, I'm going to rotate, I'm going to side bend, I'm going to push straight down. When I do this, does that hurt? A little bit? No? Side bend. Does that hurt?
No, not really.
No. How about when I pull straight up?
Nah.
No.
The thing on my upper back hurts. It's just my lower back.
Right in here, too.
Yeah.
All right, so now I'm going to have you laying face down on this table. Let me just put some face paper here.
Okay.
Okay? And on a scale from 1 to 10, 10 being, you know, the worst pain, what would you give it at the very moment? Because we're going to adjust you, and then we walk around, and I want to see if the number changes, and I want to see if you move better. That's the ultimate goal.
Right now it's compared to before it was like 11.
Oh, wow.
Now it's like maybe a 9.5.
That's a lot. Okay, so you can see how the patient's not moving ideally. Let's go face down. So keeping all the weight off of the left foot and all the sciatica is on the left side. So the last imaging you had was x-rays from more than 4 years ago, right?
Yeah.
Okay. All right, so we're going to start at the bottom and we're going to work our way towards the top, okay? All right, so relax your feet up. So short on the right, and I'm going to bend, 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 bend. A lot of tension there. Where are you feeling most of this resistance? On this right leg?
Yeah.
Yeah. So I'm just showing people out there. So normally when we do chiropractic leg check, she's got left-sided leg pain, left-sided sciatica. I would assume that there's something going on in the left lumbar, but you know that's not what's going on. It's on the opposite side. I get a lot of resistance in this front leg on the right side in here. So was this knee ever injured?
Actually, I had surgery.
On this knee?
Yeah.
What kind of surgery?
Not just
Meniscus or something?
yeah.
Okay. Okay. All right. So now, left SI joint, right SI joint, or more like right here. That's it. L5. Okay. Sensitive. So when I adjust that, just so you know, it's going to be sensitive. Okay? Because when we adjust people, we're not a low force technique. You know, you're coming here for a reason. So it's a high force technique, but the table absorbs all the force. So when I drop, the drop is going to be loud. Now we're starting to see that left side pop up. Okay. Yeah, so we're going to start with the 5th lumbar. And we're just going to get right in here.
Am I going to be able to go back to work after this?
That's the plan. I want to see you leaving better.
Okay.
Breathe in and let it out. I'm just going to follow this down. That wasn't too sensitive. Okay, so the table absorbs all the force. Breathe in and let it out. That's 5. And out. 4. Ooh, I felt 4 move. Did you feel that move?
Yeah.
So normally when I do the drop technique, I don't really feel the vertebrae move, but I felt that sink right in. So L4 sunk right in. We're going to go right into L3, different line of drive. Not as sensitive. Breathe in and bend the knees. Bend them all the way. Good. Put them down. Good. Put them down. Good. Really locked up, huh?
Yeah.
There we go. Upper door. That's it. Good. Breathe in again. And let it all the way out. I'm going to leave that. That's not moving. All right, let's go back to this leg check. Now, when I do this, where is it still? Still. Where?
And my butt.
Right side or left side?
Both.
Bilateral. So some of the stuff that you don't really see that we do off camera, we do right now. We're using this percussion device, and I'm going to kind of get right in here, and we're going to hit some of the glute and piriformis. So this is like a super powerful vibrocusser right in here, yes?
Yeah.
All right, so we're just going to get in here. I'm just going to go this way, that way. And then what we're going to do is we're going to finish with the ring dinger move, okay? So we're adjusting our spine, getting everything moving, doing some soft tissue work, and then we're going to jump right in and finish with the ring dinger, which I have a feeling is going to hit right into that L5S1 disc space. Of working with patients, you almost can like look at them and tell what level is affected with a history and an exam. So L5S1, almost positive.
Oh God.
More so?
Yeah.
And it's funny because your left side is the one that's bugging you.
Yeah, I know.
And you don't get much body work done, right?
No, I got some done last Wednesday, and then I couldn't move for
After?
the next 2 days. Yeah.
Right, because that probably means you're not doing enough. Yeah. Where do you work mostly? Drop this. Oh, there we go. Drop this. That was it. That's your talus. Talus, ankle joint. Yep. It's a weight-bearing joint in the ankle. Drop this. There we go. That was perfect. That's what I needed. Drop this ankle. Good. Now turn on your side and try sitting up.
Oh, oh.
What's different, if anything?
Okay. I mean, it still hurts going down my leg. But
Yep.
It hurts a lot in the back, in the lower back.
More.
Like my butt, yeah. Like the tailbone.
Yeah, right where I was adjusting.
Yeah.
So let's jump into the ring dinger now. When I bring your legs flat, does that hurt?
Yeah, when it comes up there, like right there, it just started hurting.
It should feel comfortable now that they're in this one position. All right, so people come at their worst and we want to get them back to living their lives without pain, without surgery. And a lot of times this is their last resort before surgery, or even they had surgery and it wasn't successful. So we're going to try to avoid surgery at all costs. So the second pin is going to go right above your left hip. Hand's going to go right about here.
Okay.
Interlock your fingers together. All right, I'm going to talk you through this. You got to breathe in and out through the nose.
Okay.
Get chin down. Good. All right, relax your head. Relax your head. Good. So now, towel's right at the base of the skull. We're going to go here. We're going to go here. I don't want it tight around the front of your neck at all. All right, let me just see if I get a good grip. There we go. Let me get a better grip. Okay, good. Breathe in and let it out through the nose. Good. Breathe in through the nose and out through the nose. Good. Breathe in through the nose and out through the nose. Good. And wiggle your left toe, like wiggle it. There we go.
Oh. Oh, God.
Oh, God.
Whew.
Big release.
Okay.
Where did you feel the most of the effective at?
Down on my lower spine.
Lower spine. Right. Okay. Catch your breath. That wasn't too terrible.
Yeah.
Okay, because just don't want to pull too hard. Drop. Got it. Wiggle those toes. That's the rest of it. Good. Stay right there. Good. Good. Stay there. Now I'm going to lower this. And then I'm going to wait till this comes to a complete stop. And then we're going to turn your whole body facing me. All from one fall 4 years ago, huh? Okay. Now that you caught your breath, try standing up now and see if it's easier to put the weight on the left foot.
Yeah. Yeah. It's easier. It still hurts in my tailbone, but
it's gonna hurt. We're doing this 6 visits, all right? This is what we're requiring for you.
That's
So
cool.
if the people watching it out there, what's different?
Okay.
You can lead and step and put weight
Yeah,
on your foot.
yeah.
Okay,
Yeah.
it's not miraculously healed.
It's not.
It's just
yeah.
the pressure's off now. The nerve is going to start healing. The disc is going to start healing. We're just putting you in better alignment, and you look more upright.
Oh yeah. I feel more upright.
You feel more
Yeah,
upright.
because I feel like, I've never felt like this. Like, I've never felt weak in my back. I've always been really strong. I've lifted weights my whole entire,
Yeah. Adult
youth.
life, yeah. But now this can be debilitating. All right, turn your whole body facing the diplomas and the instrument, the arthrostim. So when you came in, your pain level, remember I asked, you said it was a 9.5.
Yeah.
Okay. Go walk there and back, and then tell me if that number changed, and if it did, what number would you give it now?
I give it about a 7, 7.5.
7, 7.5. Okay, that's an improvement.
It is.
Usually I go for 50% in one visit. Like I like to go from a 9 to a 4. But listen, you're more. You're more.
I have a lot of weight on me.
There's a lot of pressure there, so it's going to take. But let's see you walking now. Not nearly as gimpy or limpy
No.
as when you came in. So when I said gimpy, you saw how she was avoiding the weight on her left side because all the left pain. Now you're walking with the weight on the left side a little bit better,
Yeah.
and you probably feel more stable.
Mm-hmm. Yeah.
And that's what we're looking for. So the key here is when you leave today's visit, I expect you to ice.
Okay.
Ice the lower back, ice the areas that you're sore, and then we're going to follow up next week. I would imagine we'll give it another couple visits, and then you could go back to doing what you did. But you had a slip and fall, threw your back out, never had anyone address it. Time, gravity, all those things does damage to our body. But that's why I have a job, chiropractors across the world do this stuff. This is what we do. So good first visit. We'll see you in the next video. So this particular patient came in, and as you could tell, she was in extreme pain. I always ask people their pain scale on a scale from 1 to 10, and it was a high one, 9.5. Clearly could not comfortably walk or comfortably get in the chair due to a really bad case of sciatica. We did her exam, we did her evaluation, and we found out that she was a great candidate for the ring dinger treatment protocol. And when people come in, they're looking for results, and results fast. And in the last couple months, we've seen so many patients with extreme sciatica, and they're choosing the ring dinger technique only because they want to get back to living their life without pain, without drugs, without surgery. And this is one of the quickest ways to get there. We definitely still offer other treatments in our practice, like cold laser therapy and spinal decompression and Graston and all the great tools that we use. But lately, what we've seen with patients coming in is they get out of pain quick within 2-3 visits. This video that we just did, we did the whole video from the eval to the end, and she was a 9.5 and she was down to a 7. And for the viewers that actually watched the whole video, you can see how much easier it is for her to sit down and get out of a chair and walk and actually put weight on her left foot. And that's the problem with people that have sciatica. Their pain is so bad that they start leaning to the opposite side, and then that opposite side develops problems. So she had glute involvement on both sides. That's why we addressed that with the soft tissue. And we did a full body adjustment. We did a ring dinger adjustment. And we wanted to see what it's like to adjust real people, not 23-year-old bikini models. These are real people that are coming in with real problems, just like you out there, and we're actually showing what it's like from the time they get in and the time they get out. And I've been listening to my viewers out there, and what you guys have been asking for is more than just one visit. So we're gonna do our best to get the camera in here a little bit more and follow patients through treatment plans. So you can see day 1 when they're miserable and they can't walk, to a day 3, which is literally a week later, and they're able to put weight on their feet and they're actually getting back to their lives. So as always, be sure to subscribe, like, and comment, and we'll see you in the next video.